The main ligaments on the medial side of the ankle are similar to the lateral side of the ankle. They are significantly less commonly injured. Although they have separate names, most of the physical therapy and medical field world call them simply the deltoid ligament. They are actually made up of individual ligaments, of which you can, but you do not have to or not required to learn the individual names of these ligaments. Just know that all of them put together are known as the deltoid ligament. They have, it's like more of a fan shaped, that they tend to spread out to the different structures, and we'll usually say the posterior fibers of the deltoid ligament, the middle fibers of the deltoid ligament, and the anterior fibers of the deltoid ligament, more so than actually naming the individual ligaments. With that same thought process that we used on the lateral ligaments of the ankle, we simply can test the posterior ligaments. They all resist eversion, so the posterior ligaments will resist eversion and dorsiflexion. The middle ligaments will resist pure eversion, and the anterior ligaments will resist eversion and plantar flexion. And so we can actually simply palpate all three of those areas of the deltoid ligament. The last one I'm going to show you is not truly a ligament. It's called the plantar aponeurosis, and it is on the plantar surface of the foot, and it is the most superficial structure of the foot besides the fat and skin of the foot. So directly from the medial tubercle mostly that we discussed for the calcaneus, it attaches to the bases of the proximal phalanges. So it actually tightens up when we extend the MTP, the metatarsal phalangeal joints. So we will use this action to cause that plantar aponeurosis to tighten. You can actually see the plantar aponeurosis tighten when I do that. To make sure that it is neither tender nor torn, I can use my palpation skills to actually palpate from the medial tubercle and all along the bottom of the foot, from the calcaneus to the heads of the metatarsals. And then I will simply tighten the plantar aponeurosis and palpate, and loosen and palpate. Tighten and palpate, loosen and palpate. Tighten and palpate, loosen and palpate. And when it's tightened, it's much, much easier to feel and locate trigger points, nodules, tender points, depending on your philosophy or background.